If you've noticed that students are doing well on exams, but when they get to the clinical setting or the SAM setting, there's a disconnect. They're not able to make those safe patient care decisions that we know is essential in clinical judgment. What we know about nurse educators when they are on the journey to achieve CNE or CHESI, and even clinical leaders, nurse managers that are on their journey to achieve CNML, one consistent issue comes up, and that is the ability for students to really transfer that knowledge from the classroom and that didactic setting, whether they're in our classrooms from an academic perspective or they're in a classroom in the actual healthcare setting. Students really struggle when it comes to making those real-time patient care decisions. So what is it that we need to do? Well, that's exactly what we're going to talk about today. So welcome everybody. If this is your first time joining us, welcome back. And for those that are returning, we're glad that you're back too. Make sure that you subscribe to this channel. That's how we stay relevant. That's how we stay here on YouTube, is to make sure that we have enough subscribers that are tuning in to listen to our information and really process the concepts that we are discussing. All right, so let's dig deep into our discussion for today, which is all about coverage. We spend quite a bit of time, whether that's the academic setting or the healthcare setting, because both are essential as we help students really bridge that theory practice gap, close those loops so that they can provide safe patient care and ultimately our patients can have great outcomes. That means that we have to develop this partnership that AACN talks about and the evidence shows is going to help our students be more practice ready and ultimately be more successful in the clinical setting. Covering content is an essential part of the nursing student's journey, and we know it's not equivalent to competence. Just because we engage with developing deep lesson plans, so we have a great strategy to help our students learn, we know that automatically it is not equivalent to competence. We also know, based on data and hundreds of nurse educators that we discuss various topics with every month during our monthly boot camp, is that there isn't a problem with content. There's enough content for us to teach without question. Here's the missing part. How do we ensure that learning is happening? How are we engaging with our learners on the journey to ensure that we're not leaving them behind? To make sure that they're having this deep comprehension of concepts that we know is essential when they are on the journey to not only pass NCLEX, but also ultimately be able to deliver competent, safe care. In this series, we're continuing a conversation related to blind spots and sometimes the faculty misses that we engage in. So how is it that you're going to integrate these topics that we're studying about into your CNE, CHESI, or CNML plan? Well, we're helping you focus on key concepts so that you're not wasting time studying concepts that are not going to be helpful. We want you to be laser focused and avoid any sidetracks that get in the way of you staying focused on your CNE, CNML, or CHESI journey. So we want you to study this content and not that content, specifically as it relates to the CNE journey. Welcome back, and we hope that you have already subscribed. And for those of you that are new here, you want to make sure that you're taking some time to really reflect on our content. Happy New Year to everybody if this is the first snapshot that you're listening to and watching here at Dr. So's Educator in 2026. We hope that you spent some time resting and reflecting on what you need as a nurse educator, as a nurse manager. When we're able to have our needs met, first and foremost, we're going to show up better in the classroom, better in the clinical setting. Billings and Halstead is your key resource to use as a nurse educator. We call Teaching and Nursing. Now we are continuing in the 6th edition. However, the 7th edition is available. But in the 6th edition, this is going to help you stay aligned with the concepts that we are discussing as you move forward on your CNE journey. And we have gotten the question from colleagues about a CHESI monthly boot camp as well. Just know that that is in the process. So just stay tuned if you're on the CHESI journey or even the CNML journey. Just know that some of the concepts that we're talking about is going to directly align with your journey to achieve certification. Other concepts, not so much. Okay, so do know that we are listening to our stakeholders and we're excited to be developing content to help you move monthly, consistently on that journey to achieve certification if you're a nurse manager, nurse leader, or you're a STEM specialist. So what other resources do you need? Study worksheet. Now for those colleagues that have the study workbook, that's an excellent resource as well. However, just make sure you print out the study worksheet that is included in this description. The next resource we want you to have, and we know time is our most valuable resource, is uninterrupted time. We try to, as much as we can, scale down our snapshots to 15 to 20 minutes or so. I know our last one went a little long because we went deep into some concepts that are helping many nurse educator colleagues on their journey to achieve success. Okay, so that uninterrupted time is going to allow you to stay focused in concepts that are really going to help you become a better nurse educator. That's what these snapshots are all about, helping you get 1% better every single day. Okay, so let's go back to the study worksheet. If you printed it out, I want you to go ahead and write down 3 things today. So number 1 is going to be today's date, whatever date you're watching the snapshot. Number 2, what is the takeaway that you want to walk away with at the end of our time together? Now that you know a little bit about what we're going to be exploring, I want you to write down, what is it that you want to walk away with? Okay, and then the third step, or the third part of what you're writing down on your study worksheet, is going to be the number 1 barrier. Okay, we're kicking off 2026 strong. You're moving forward on your mission to achieve excellence as a nurse, no matter where you are on your journey. And we want you to have a clearly defined process about that barrier and how you're going to push past that barrier to achieve success. Your ability to achieve success on whatever goal you set to accomplish is going to be increased. Some research says 70%, some says up to 90%, when you have a consistent community of support. That's what we provide here at Dr. Sellers Educate, and we're glad to have you joining us for this snapshot. All right, so uninterrupted time, you have your study worksheet, you printed it out. You can always pause this snapshot, come back when you're ready if you don't have your resources. And then the next term that we want to introduce to you all, and for some, is just a reinforcement, and that is learning theory. So the content we're discussing today is actually aligned with 5 different competencies. Yes, 5 of those NLN nurse educator competencies is aligned with the concepts that we're discussing today. David Cope learning theory is a key framework for us to discuss as part of our conversation today. His work says that there are 4 phases associated with the learning journey. We want to engage students through all 4 phases to ensure that learning is actually happening. It's not enough for you to assume that learning is happening just because you have taught the content, because you have covered the content, right? It's an assumption. So you want to make sure that students have actually learned these concepts. And as we move forward in this series, you're going to have a better understanding of exactly how to do that to maximize the time that we have with our students, because we know the time is limited. And this is the other point I want you to remember. With our adult learners, they are so easy to get distracted, right? Just like us as humans. So we want to make sure that we're maximizing that in-person learning time to the fullest ability so that we can engage as a partner with our students on the 4 phases of the learning journey that David Cope talks about. Chapter 14 in Billings and Halstead is going to give you a lot of in-depth information related to his work to help you have that deep comprehension of concepts related to learning theory, as well as the other 4 categories. Well, there's actually 5 categories of learning theory that you want to explore. Again, that's chapter 14, table 14.1 for the 6th edition. All right, and how many of you are feeling overwhelmed? All right, so I'm sure if I was able to see you right now, I would see some hands raised, even though we're just starting the spring semester already, especially, and I'm just realizing there's a typo. If we are on the journey to help our students with integration of maybe some mastery exams, right? You're going to overlook that typo. Just when you think you've caught every typo, you find one that you didn't expect. All right, so if you're feeling a little overwhelmed, this is what we want you to consider. Not only stepping back to reflect, but engaging in purposeful work to help you avoid those distractions. Well, that's exactly what Rooted in Wisdom does for colleagues. This is a 365-day devotional for you to help you be more inspired and to lead with purpose as you transform the healthcare environment. That's the heavy work that we're doing. We're actually engaging in a transformational process with our students to validate that learning has happened. Okay, so if you're feeling overwhelmed, know that you don't have to stay there. Know that you have a resource that's going to help you get unstuck. All right, so now we're ready to dig deep into our content. What I want you to remember is that this focus, the focus that we have in our discussion, is realizing that content coverage alone is not enough to help validate that students have learned. We want to engage in this partnership through discussions, through simple conversations with our students about the concepts that they're able to have a deep understanding about. And it's the same strategy that you're going to use as you move forward on your journey to achieve CNE. When you're thinking about concepts to study, first of all, we only want you using as your primary resource Billings and Halstead, Teaching and Nursing. Okay, again, we have the 6th edition, but the 7th edition is available. Let's go ahead and talk about why we're referencing the 6th edition. It is because this is the one that the exam writers used back in 2023 when the blueprint was revised and those new questions were developed. Okay, so this is why we're using the 6th edition. And if you need the 7th edition, we do have the actual specific pages or specific chapters that are aligned with that version, with the 7th edition. Okay, it's right here in the description. If you can't find it, just send us an email, info@drsillis@educate.com, and we're happy to help you out. All right, so another resource as we dig deep into these concepts that you want to think about is related to your thought-provoking question. Okay, and that's what we want to look at next. And then we're going to go to Billings and Halstead to make sure that you all have a deep comprehension of the concepts. All right, so let's take a look at this thought-provoking question. I'm going to make it enlarged so you all can see it. So a nursing program's NCLEX pass rate has declined for 2 consecutive years. Faculty report that all required content is being covered, lectures are thorough, and students score well on unit exams. However, during capstone and simulation, students struggle to prioritize care, apply pathophysiology to changing patient conditions, and transfer classroom knowledge to clinical judgment. The curriculum committee proposes several solutions. Which action would most effectively improve learning transfer without increasing curricular overload? Before we even get to the 3 options, I want you to think about 2 things, okay? So first and foremost, what is this question really asking you? Second question I want you to think about is, what is it that I know for sure about concepts related to this question? When you get to the CNE exam, there are 150 questions, and we know 130 are scored. The other 20 are not. They are pilot questions that are being tested out. And you will have 3 hours to take the exam. Okay, so 3 hours to take the exam. So you want to pace yourself as you're moving forward through those 150 questions. We also recommend that you go to a testing center. Okay, and I want to talk a little bit about why. We know that with technology, it's great when it works. And when we lose internet, it actually can freeze the exam and cause all kind of problems. Okay, so the exam is facilitated by measure learning. If you have any type of technical difficulties, the ability for the proctor to help you is going to be limited, right? Because they are virtual. When you go to a testing center, you're going to have a different level of support. Okay, so this is why we highly recommend you go to a testing center if at all possible. It's going to decrease that anxiety because you know you're going to have the support of a proctor, a testing center, to avoid any of those internet issues, any computer glitches that we know inevitably happen. All right, so I'm going to give you a few seconds to think through this thought-provoking question. And I want you to write down your answer as we look at the 3 choices. Might be helpful if I give you those, okay? I want you to think about your correct option and the rationale, okay? So at the end of our time together today, that's exactly what we're going to walk through together. So we have A, add additional lecture content to reinforce weak topic areas that aligns with prioritization. B, replace select lectures with structured case-based applications across multiple courses. Or C, adopt more active learning strategies and independent remediation modules. All right, so I'll give you all about 5 more seconds to write down the correct option. And then you want to think about the rationale as well. And the other point I will share as you all are writing down your rationale is we call these thought-provoking questions for a reason. We don't write questions for NLN. It would be a conflict of interest. And we want to stimulate thought, right? This is not about choosing the best answer and feeling more validated about your knowledge. That indeed can cause you to have a false sense of confidence related to your readiness for the CNE. And we hear colleagues, we've seen it on social media posts where they are taking a certain number of questions every day and they feel more confident about their ability to take the CNE. And for some colleagues, they do achieve success. And this is what we know based on feedback from NLN commissioners. Those questions are not written by the exam writers for the CNE, and it's whether or not those questions really are aligned with concepts from Billings and Halstead. We don't know, right? Because we don't know oftentimes who's written those questions, how old those questions are. So when we are engaging in conversation with you all about thought-provoking questions, we want you to go deeper. This is why understanding the rationale is so important, because we don't write questions for NLN either. So we want you to have a deep comprehension of what those actual concepts are related to the thought-provoking question. All right, so let's take a look at 3 key points that we want you to walk away with related to our conversation. And that is, why is it that we can't only focus on content? Why is it so important that we focus on learning? All right, so here's point number 1. We want students to engage in this deep thinking that we know Tanner's clinical judgment model, NCSBN clinical judgment model talks about. And it's not new. That's the other point I want to make. Since I was in nursing school, that was 35 years ago when I started, or 34 now, it's always been about application, right? Our ability to truly connect the dots. And we have to engage in intentional content, right? Purposeful content in our courses. We have to focus on content that is a must know versus not focusing heavily on content that is nice to know. Again, we have to focus on that content that is a must know for our students in order for them to have this deep comprehension of concepts that we are talking about. So first, coverage focusing on faculty comfort can get us in trouble, okay? We want to make sure that we're focusing on students' competency. How do we validate the students are competent related to the concepts that we're teaching? Well, we want to have discussions with students. We want to engage in unfolding case studies. We want to identify where those knowledge gaps are in a way that allows students to go back, to reflect on those knowledge gaps, read in the textbooks, having that deeper comprehension of concepts in a way that allows them to make safe patient care decisions and engage in that application and analysis that we know is essential not only for NCLEX, but also clinical judgment in the actual practice setting. Number 2, remembering that transfer requires application, not just exposure. We want students to actually practice these skills in the classroom. Patricia Benner's work highlights the importance of bridging that theory practice gap and not waiting until we get to that clinical or even SIM skills lab setting. We want to do it in the classroom. How do we do that? Using the textbook, right? Talking to students about content that's actually in their textbook, and that's what we want to do now. So if you have Billings and Halstead 6th edition in front of you, turn to page 118, curricular elements, that second column where the subheading is organizing frameworks. Okay, so I'm going to read, in the interest of time, a couple of concepts related to this really important work that we're talking about. Under organizing frameworks, it says, second sentence, organizing frameworks do provide a logical structure for cataloging and retrieving knowledge. This structure is essential to the processes of teaching and learning as faculty guide students in the development of cognitive linkages among knowledge. Not only does this help students, but also faculty understand the abstract nature of nursing. That's so good. As we think about the frameworks we're using with our nursing curriculum, we've got to make sure it aligns not only with the what regarding safe patient care decisions, what the evidence says the practice should be, and also the why. Why is it that we want students to follow these 10 steps for sterile technique? Why is it that they can't skip a step? And how do we transfer that knowledge in a way that allows students to truly learn, have that deep learning associated with the why and the what? We know that those steps, the proper steps to take, are essential when it comes to safe patient care. All right, so that's what you want to remember. Transfer requires application, not only exposure. A key memory point we want you to have too as you're studying for the CNE exam is that there's no need to focus on NCLEX style questions and how to write and analyze, right? Those type of questions are not going to be on the CNE exam. So yes, as part of our ability to engage in the level of scholarship we need to as an academician, yes, we need to understand how to write NCLEX style questions. However, that is not needed for the CNE exam. Here is what is needed is understanding, having that breadth, right? That deep comprehension and not just the depth, right? So we want to think about depth beating the breadth, right? It's important to have both. Okay, so let me clarify that again. We want to make sure that we go deep in that comprehension of concepts, not just thinking about the breadth or the complexity of that care related to NCLEX and clinical readiness. All right, so let me give you an example to kind of bring it to life. So when we think about respiratory disease, let's just use heart failure as an example. Those of you who've tuned in before know cardiac is my specialty, so all my examples are usually cardiac related. We want students to understand why it's important to check oxygen saturation before, as part of the assessment, before they decide what the intervention should be, right? So for a heart failure patient, students are going to check that pulse ox and they're going to say, oh, it's only 90%. I probably need to add some oxygen. Not necessarily, right? We want to make sure students understand all of the steps associated with assessment of a heart failure patient, right? That's the breadth. And we want students to go deep in understanding about not only what a 90% oxygen saturation could mean for a heart failure patient, but also what are some other assessment elements that I want to look at, again, depth, related to care of the heart failure patient. I want to look at, okay, so let me listen to their lung sounds. Let me look and see if they have labored breathing, right? Assessment starts with observation. Yes, we're going to use our stethoscope. We're going to use all of the tools that we have available to assess, to do a proper assessment of that heart failure patient. And we want students to remember the value of their eyes, right? To look at the patient. Oftentimes, all of the bells and whistles in the acute care setting can become a distraction, right? They are a piece of the puzzle. However, we want students to use the basic skills that they have, such as observing the chest rise, observing if patients have labored breathing. Let's take a look at their skin, right? Let's look and see if they have swelling. All of these specific assessment components help inform students, again, the depth of that assessment, that cardiac assessment for the heart failure patient is key. Now, when we talk about breath, yes, we're going to think about oxygen saturation and assessment across the continuum of care for all patients. When we think about heart failure, when we think about the GI patient, when we think about the post-op patient, right? We're thinking about how assessment occurs throughout the curriculum. However, we want to be laser focused from a cardiac standpoint on care of the heart failure patient. Okay, so hopefully that's a good explanation for you all when we talk about the difference between going deep versus going wide, also known as breadth. That's the word I couldn't think of earlier. Going deep is important, but also going wide. But when it comes to NCLEX preparedness and clinical readiness, specifically the development of clinical judgment, depth is key. All right, so that's the takeaway we want you to have from that slide. Higher order thinking is essential as we wrap up our time together as part of this discussion. How do you engage in higher order thinking? Number one is using clinical mini vignettes or those unfolding case studies, application, 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 and remediation and support. These are three critical components that help close the theory gap, bridge the links that happen, connect the links that sometimes students are not able to connect on their own. All right, so let's take a look at the thought-provoking question. If you chose B, give yourself a round of applause. You are correct. Replacing selected lectures with structured case-based applications across multiple courses is essential. Now we want you to understand the rationale. B focuses on application, spacing, right? We're talking about across the continuum of the curriculum, and integration, which are core concepts of learning transfer and clinical judgment development. A increases exposure, but not necessarily application. It can actually increase cognitive overload. Okay, if we think about adding additional lecture, that's what happens. We increase students' cognitive overload. And then C actually shifts more responsibility to students without focusing on that key element of instructional design. You know, I've worked with some amazing curriculum designers, instructional designers over the course of my academic career. And I can tell you, even though they're not nurses, they have this amazing skill set to truly connect the dots in a different way than we do as nurses. Okay, and maybe you have some nurses that are part of your curriculum design team. That's a great skill to have as well. So we want to truly partner with our designer, our curriculum design team, to figure out how can we bridge that theory practice gap, how can we align the curriculum so that our students are learning, and most importantly, so the transference of knowledge happens in a way that leads to application, integration, and safe patient care. So what's your number? Let's do a temperature check as we close out. Are you feeling lost? Maybe that was a lot of alphabet soup. Or do you feel like you're ready to teach? Maybe you got it. You understood exactly the key concepts you wanted to take away from our conversation together, and you're ready. Know that as you're moving forward on your journey, we all are at different points. We're all are at different phases of our nurse educator journey. And we're here to support you on that journey until you are successful. The only way you won't achieve success is if you quit. We look forward to seeing you in our next snapshot. Happy New Year's and have a great one, everybody. Take care.